Hola y bienvenido a Basic Spanish for OT, PT, and SLP. Mi nombre es Juanita y yo soy la presentadora. Yo soy una asistente de terapia ocupacional y yo soy la autor de este libro, Basic Spanish for OT, PT, and SLP clinicians in the acute hospital setting. This book, as well as the ebook, can be purchased on Amazon.com. If you haven't been following along in the book, following along on this channel, I suggest that possibly you go back to some earlier videos and it will bring you forth to where we are at this time. I would also ask that if you would, please hit like or hit subscribe so you will get more information when these videos are uploaded, as well as tell a friend. Let other therapy clinicians know that this resource is available. On today's video, if you don't have the book, I'm going to go back again. If you don't have the book, I really do suggest that you try to purchase the book because it will make following along on these videos, on these series of videos, it will make it much easier. Because if not, you'll feel like I'm all over the place because you won't understand where I'm in the book or what I'm referencing. So, vamos a empezar. On page 77, there are 7 terms that we're going to talk about. So the first one, are you comfortable? That's a question that as therapy clinicians, we are always going to be asking our patients. Are you comfortable? Especially at the end of a session, you want to make sure that your patient is comfortable, whether they're sitting in the bed, laying in the bed, or sitting in a chair. So we're going to use the familiar form. In the book, I use the familiar form, but on the channel, I think I'm going to use the formal form. Okay? So if you are referring, and remember in Spanish, there are two genders that they use. So it is masculine and feminine. So if you are referring to someone masculine, you want to use the masculine form, you're going to ask, ¿Está cómodo? ¿Está cómodo? ¿Está cómodo? That means, are you comfortable? Okay, and that's in the formal. If you're talking to someone feminine, you want to use the feminine gender, then you would use ¿Está cómoda? ¿Está cómoda? ¿Está cómoda? So for masculine, ¿está cómodo? For feminine, ¿está cómoda? Okay. The next one, are you hungry? Now, we don't generally feed. Maybe our speech language pathology practitioners are doing some kind of form of feeding, but for the most part, occupational therapy, we're not actually feeding the patient. But you may want to ask a patient, are they hungry? In Spanish, you're technically not asking, are you hungry? You're asking the person, do they have hunger? So instead of using the verb estar, you're going to use the verb tener. So it's going to be, ¿Tiene hambre? ¿Tiene hambre? ¿Tiene hambre? In the book, I did ¿Tienes hambre?, which is the more familiar form. ¿Tienes hambre? That's a more familiar form. And that doesn't matter the gender, feminine or masculine. Okay? The next one down is, are you thirsty? And that one is the same thing. You're not asking, technically, are you thirsty? You're asking, do you have thirst? That's the way it's stated in Spanish. So that one would be, ¿Tienes sed? ¿Tienes sed? ¿Tienes sed? And again, the familiar form would be, ¿Tienes sed? ¿Tienes sed? ¿Tienes sed? The next one, we go back and we're going to use the estar form, the estar verb again. Are you tired? And again, it's going to be masculine or feminine. So you're going to ask the person, ¿Está cansada? ¿Está cansada? ¿Está cansada? I think that didn't come out too well. ¿Está cansada? That's the feminine form, or are you tired? If you're using the masculine form, ¿Está cansado? ¿Está cansado? ¿Está cansado? Okay. The next one, to be careful. It's something that we generally say. You're walking with someone and you want to tell them, be careful, be careful. So you would generally say, ten cuidado. Ten cuidado. Ten cuidado. And if we were to translate that directly, that would be have care. Have care. So be care. That's in essence is saying be careful, or have caution. Have caution. Okay. Now this is one that I know OTs and PTs alike, clinicians, we use this all the time for bend your elbow. Bend your elbow. So you're going to say dobla el codo. Dobla el codo. Dobla el codo. Okay? And again, this is why the book is so important. If you will refer to an early part in the book, you will hear me, I think it's under helpful hints, and I have a video here regarding helpful hints. Using visual cues are so important. So let's say, for instance, you could not remember the name of the elbow. You didn't remember el codo. Couldn't remember that. But you remembered dobla, because you remember that was. So if you say dobla, and you do this, dobla, it will communicate the idea that you're asking the person to bend their elbow, even if you couldn't remember. Okay? So let's say it was the other way. You would remembered el codo, and you couldn't remember dobla. So you can say el codo, el codo, el codo. So again, visual cues are important. Learning commands are important. I will say this now, since I am starting to get into the part where we're doing questions and commands. If you have an certified medical interpreter with you at your facility, please use them. It is very important. It makes much easier. But I've heard from so many people that they wish they had a basic knowledge of Spanish, and that's where the idea for the book came in, because some people said they did not have any idea. They didn't know any words, and it would be so much help, very useful if they were in situations in which they didn't have an interpreter available. And sometimes it makes it much quicker than trying to look it up on, pull out your phone and, I need to find out, how do you say this word? If you just had a basic understanding, I can testify that it is. And the last one, I'm going to take this from page 77, even though it crosses over to page 78, we'll take it. It's bend your knees. Bend your knees. So remember, dobla el codo, but now you want to do your knee. So you want to say dobla la rodilla. Dobla la rodilla. Dobla la rodilla. Now, I have a video. I'm not sure if I uploaded it yet, but I have a video on the parts of the body. So it would be wonderful if you have an opportunity to review that before you got to this part, before you arrived here. Okay? So that's it for today. Again, if I just give you words of wisdom on learning Spanish, remember, learn your phonetic sounds first. So you learn your alphabet, learn the names of things, and learn the gender that is assigned to it. Okay? And then learn these basic commands. Practice, practice, practice. The more you use it, the better you will be. Practice makes permanent. That's it for now. I'm at the 10-minute mark. Gracias por venir. Nos vemos. I'll see you next video.